Today we're at Aesthetica with Dr. Stefano Pompei, and we're going to talk about facelift surgery. Hello, doctor. How are you?
Fine, thank you. Thank you for this nice opportunity.
So let's start with our questions. What is facelift surgery and how is it performed?
Well, first of all, we have to clarify that facelift is one of the methods, together with other procedures, for facial total rejuvenation. So that's normally we use facelift, blepharoplasty, mentoplasty, and in some selected cases, even for the aging nose, rhinoplasty can be a part of the rejuvenation techniques. Facelift is today the concept are looking for the most natural possible result, because the hyper-pulled kind of faces in the past are not in line with the actual trends. So we try to repositioning. It's not just pulling back the skin or removing the skin excess, but repositioning the tissues, the skin and muscles. That's why it's a complex kind of surgery, but it's something that can be absolutely safe for the patient for doing that.
That's interesting. And who could be the best patient to do the facelift surgery?
That's a very good question, because normally speaking, we don't have all the orientation between the patients, because the perfect candidate normally is a patient that had already treatments for cosmetic medicine products like fillers, Botox, whatever, but they have lost the line, the jaw line, for example, or the neck lines. It means the flaccidity is important, it's significant, losing the contouring of the face, and so the elasticity is not good anymore, so we have to reposition it with a surgical procedure like that.
And what type of recovery can the patient expect, and what is the pain level?
Pain level is minimal in comparison with other surgery. For example, even considering liposuction, because bruises, you sit on top of the bruises sometimes, so it's a more pain, more discomfort. Facelift is one of the less painful kind of post-op that we can have. And the most important thing is to understand, to explain to the patient that the bruises and swelling is a part of the post-operative period. So it's normal that it needs time, few weeks, for total reabsorption of the bruises and the swelling. So normally we say to the patient, the final best part of the results is after 2-3 months.
That's amazing. And for how long the patient can maintain the results after the surgery?
Yeah, that's another good question, because normally the idea that it's temporary, and it's not true, because facelift, when it's well done, is lifelong. That's the effect as forever, in comparison, of course, with the same patient, another age 10 years later, it's going to be much better than without surgery. So the result is maintained even if the age continues, even if the aging effect in the negative sense can be different in person to person, but the final effect is still there after even 20 years.
Thank you so much, doctor, for all the insights. It was lovely meeting you, and we'll see you on the next episode.